Hello guys, today we gonna talk about our representation, which is phototherapy device, and some concepts that are the what is phototherapy, history of phototherapy, units of measurements, type of radiations, phototherapy light source, vital skin disorders and the treatments, side effect of phototherapy, and the question. Okay, let's start. What is phototherapy? The phototherapy, also known as a light therapy, is therapeutic method that is done with the non-ionizing portions of the electromagnetic spectrum. The objective of phototherapy is heal to the clinical condition, minimizing the adverse effects. Light contains energy in the forms of photons. Light observing the molecules or chromophores can utilize the light energy can make certain change. Modern phototherapy light sources include the sunlight, fluorescent light, halogen light, fiber optic systems, and the light-emitting diodes, etc. History of phototherapy is phototherapy has been used to treat the medical conditions for back as 3,500 years ago when ancient the Egyptians and the Indians used sunlight to treat skin disorders like vitiligo. Modern phototherapy using artificial light source began with Niels Finsen. Widely regarded as the founder of the modern phototherapy, he treated skin disorders called lupus vulgaris and with sunlight and ultraviolet radiation. From the on, usage of phototherapy in medical fields grew, techniques were refined and developed, and it eventually gained widespread acceptance. And there's some measurements or units of measurements that we should know before starting the phototherapy device, and that these are the radiant energy, it's the amount of radiation expressed in joules. Radiant power, the rate of delivery of energy expressed in watts. Irradiance or light intensity refers to the number of photons as directed or received per square centimeter of the exposed body surface area. The radiant power per unit area expressed as a nu watt divided centimeter per square. Exposure dose, the radiant energy delivered per unit area of the given surface area in the given exposure time. It's also expressed in joule divided centimeter per square. And there's some types of the radiation, and as you know, the light has a spectrum. Also, the sunlight has a special spectrum, such as ultraviolet radiation. It has a three types of the ultraviolet radiation, which are the ultraviolet C, ultraviolet B, and ultraviolet A. And the ultraviolet C is the shortest wavelength absorbed by the atmospheric ozone. Ultraviolet B has the largest effect on the top of layer skin, and also it causes the redness, burning, or skin cancer. Ultraviolet A it has the longest wavelength, and it's reached deep into the layer of skin, causing aging or leaking. And their picture shows which ultraviolet radiation can passes from the atmospheric layer and the skin. And it is the light spectrum and the ultraviolet light, and as you see there, the ultraviolet light, infrared light, radar, or FM TV, something like that. And ultraviolet phototherapy produce an immunomodulatory effect on the skin and widely used for the treatment of psoriasis, eczema, and other conditions, which is some type of the skin illness. Ultraviolet light is important for vitamin D synthesis. A variety of reports have suggested that the low level of vitamin D early pregnancy may be associated with the adverse development effect. Whether ultraviolet light exposure decreases the folic acid levels remains to be studied. And the ultraviolet B radiation is it is the range of 290 to 320 nanometer of ultraviolet light. It's absorbed by the epidermis and the superficial dermis. As you know, from our yes, and you know this is an epidermis, and the superficial dermis is it's also called the skin surface. And let's move on. It's some type of mechanism, end of the mechanism, the generation of reactive oxygen intermediates, which has a downstream effects. Also, it means the ultraviolet radiation generally downstream effects for DNA damage, lipid peroxidation, activation of signal transduction pathways, and stimulation of cytokine production. And here are the two types of ultraviolet phototherapy. They differ in the range of wavelengths used. It's one of them, the broadband ultraviolet B and the narrowband ultraviolet B. And the broadband ultraviolet phototherapy uses the ultraviolet range of 280 to 350 nanometer of ultraviolet light. Fluorescent light generally used for this method. For narrowband ultraviolet B therapy uses a smaller wavelength of ultraviolet light from 311 to 313 nanometer. This smaller range uses the most effective wavelengths of light and reduce exposure to wavelengths or light that are more likely to burn the skin. And as you see, guys, this is the table of ultraviolet narrowband, and you can compare the ultraviolet B broadband and undriveable burning effects. Why narrowband ultraviolet B is different? Because the conventional broadband ultraviolet B lamps emit a variety of wavelengths ranging from 280 to 330 nanometer. Narrowband ultraviolet B virtually eliminates the superfluous and harmful ultraviolet by emitting on wavelengths 211 to 212 nanometer. The clinical studies shows the peak therapeutic effectiveness of ultraviolet B within the range of 295 to 330 nanometer, but wavelengths below 300 nanometer can cause erythema or severe burning and increase the risk of skin cancer. Also, there are some benefits for narrowband ultraviolet therapy. It's eliminating the ultraviolet in wavelengths below 311 nanometer permits the higher intensities and longer exposure time, so the patients can derive the maximum benefit from the phototherapy. Also, it's increased the effectiveness to permit more aggressive treatment regimens, resulting in shorter course of the treatment. Extensive research confirms the patients not only avoid the danger of serious burning from suberythemal exposure, they may also enjoy longer remission periods after treatment. Remission periods are similar to those with PUA, and it's called also the paralysis ultraviolet type A therapy, and markedly superior to broadband ultraviolet B treatment. Studies shows 38 and 40% of narrowband treated the patients require no additional therapy for at least 12 months. Also, there's one example of bandwidth calculation, and let's check this. An approximately monochromatic light beam has a wavelength of 500 nanometer and a wavelength spread of 1 nanometer. Calculate the frequency bandwidth. The wavelength frequency related the F equal to C divided lambda. Elementary differential leads to F equal to Result of the calculation 1.200 GHz. Note that the approximate monochromatic light wave has a very large frequency bandwidth. Whole narrowband ultraviolet B cabinet and the narrowband ultraviolet B unit for the treatments for hands and feet. And also this is the block diagram of medical lamp. Also there is the lamp system, the lamp system of ultraviolet B 311 nanometer. And the ultraviolet A radiation, it is the range 320 to 400 nanometer of ultraviolet light. It can reach the mild or lower dermis, more effective than ultraviolet B for the skin disease, in which cutaneous pathology lies deeper than the superficial dermis. The mechanism of action is the first generation reactive oxygen intermediates, ROI, are formed. Mitochondrial enzyme complexes during oxidative phosphorylation can produce pyrimidine dimers DNA, but less effective than ultraviolet B doing so. Ultraviolet A induced oxidants cause the DNA damage, lipid peroxidation, structural and non-structural proteins damage, organelles such as mitochondrial damage. The generation of oxidants following ultraviolet exposure has been implicated in photoaging of the skin and skin cancer. And there's a figure which is a ultraviolet A phototherapy expands the treatment options. There is also unit. It's also a unit of a phototherapy device. Ultraviolet A to 1 phototherapy. It can be used in the treatment of certain autoimmune connective tissue disorders such as lupus, along with other complex conditions including cutaneous T-cell lymphoma, vitiligo, morphea, graft versus host disease, and the systemic sclerosis. Current research continues to point additional treatment indications, the specific to medium to high dose ultraviolet A phototherapy and overall effectiveness. Also there is a figure of the phototherapy device which the ultraviolet light beam comes from there. PUVA phototherapy is ultraviolet A use the wavelength range from 315 to 400 nanometer and is found in natural sunlight. PUVA phototherapy combines ultraviolet A with prosalan, a medicine. It's a medicine that increases your sensitivity to the light. The product name also it's oxalate. The use of UVA without prosalan is not an effective psoriasis treatment. Together, PUVA works to slow down cell growth and can clear symptoms for several months. Adults with moderate to severe psoriasis can use the PUVA phototherapy. It can be used to treat the type of psoriasis like plaque and goutte. PUVA is also effective at treating psoriasis of the hands and the feet. PUVA is not usually recommended for treating the children or teens, but it may be an option. The other treatments have not been successful to avoid the possible side effects or the other treatment options. As you see the picture, there's a therapy with PUVA and the before and then the after, and you see how it's changed. The localized PUVA is a those patients require treatment to small areas only may be treated using a smaller hand and the foot unit. Bathwater PUVA may be suitable. In this case, the hands or feet are soaked in a dilute solution of methoxylan for 30 minutes then immediately exposed to UVA, ultraviolet A. And it is there's a one unit for the whole body through a cabinet, and it goes into there, and you expose some ultraviolet A, B, and the treatment after some months, the treatment can resolve your skin problems. There's a process ultraviolet B treatment. The POB phototherapy is the combination of surveillance and the ultraviolet B, which is the short wavelength ultraviolet radiation. It is rarely used, the wavelength that activates the surveillance most effectively used in ultraviolet A range. And you see the after the treatment how to change the skin. In the lasers in phototherapy, the laser ultraviolet B phototherapy, also called targeted phototherapy, uses a small beam of ultraviolet B light to treat specific areas affected, similar to narrow band ultraviolet B. However, the laser ultraviolet B phototherapy has the added benefit of being able to treat the only affected areas of the skin. This reduces your risk of exposing unaffected skin to ultraviolet light. The most common form of the laser ultraviolet B phototherapy is the excimer laser. This includes the brand name X-Tac laser. The excimer laser beam is less than the 1 inch across, enabling to target a specific area. And also the picture of the typical laser therapy device. The photodynamic therapy is a specialized type of phototherapy essentially for the treatment of skin cancer. In comparison to other regimens, photodynamic therapy is less invasive and produces a better cosmetic outcome with a little or no scarring. Recently, it has been demonstrated that the photodynamic therapy can also be used for the treatment of inflammatory skin disease. Photodynamic therapy involves the use of light and the light-activated dye, the photosynthesizers, that glycolize preferentially in cells with an increased metabolism, but not a normal for healthy cell. The A is a photosynthesizer, is a photoactivatable multifunctional agent which, upon a light activation, can serve as both an imaging agent and a therapeutic agent. And the B is the sequence of administration, localization, and light activation for the PS for photodynamic therapy or fluorescent imaging. What are the benefits of the combination for treating the cancer? Existing treatments for cancer suffer from a major shortfalls, including resistance to treat and the post-treatment disease recurrence. This, combined with the need-specific and the targeted therapies, highlight the need for a new mechanistically rationalized combination therapies that could synergistically enhance treatment response and improve patient outcomes. Several distinctive features and the photodynamic therapy make it an attractive therapy for a range of cancer and the other diseases, especially when viewed as a component of a large treatment regimen. In the first one, drug-light combination lends itself to the layers, the selectivity, and the second, the photodynamic therapy and the chemotherapy have proven be an effective combination treatment. And the third, the synthetic nature of a photosynthesizer allow the rationally designed molecular targeting. And the last and fourth one, the optically properties of photosynthesizer make them the valuable theranostic tool. And you see in the figure how the combine of photosynthesizer and the light affect the tumor in the photodynamic therapy. The various functionalized organic and inorganic nanomaterials are integrated with photosynthesizer drugs for significantly enhanced efficiency and the tumor selectivity of photodynamic therapy. And you see some picture about the treatments and the photodynamic therapy, photofluorescence, and the other figure is the result of photodynamic therapy.
I will tell you about the light sources used in phototherapy. Phototherapy light sources. Natural sunlight has been used to treat skin disorders since antiquity. The widespread use of artificial light sources for phototherapy started in the 19th century. The most important characteristics of a phototherapy light source are physical dimensions, total radiant power, directionality and uniformity of the emitted light, and spectral intensity distribution. Additional factors for practical applications are the cooling requirements, useful lifetime, replacement cost, and optical, thermal, and electrical hazards. Phototherapy light sources include sunlight, incandescent lamps, fluorescent lamps, electric arcs, light-emitting diodes, and lasers. Lasers are most useful for applications where therapeutic light is delivered via an optical fiber to a small treatment field. The development of light sources for specific phototherapy applications is currently a major part of the technology. First, I start with sunlight. Sunlight with its adjacent spectral regions UV and RI is the basic requirement for life on Earth. Knowingly or unknowingly, we are always exposed to its influence, and its therapeutic action has been known to man since time immemorial. However, natural daylight as a therapeutic agent has nowadays been displaced to a large extent since artificial radiation sources are available that are ready for use at any time and whose intensities and spectral distribution can be adapted to the respective treatment function. Nevertheless, the daylight is also included in the compilation of the UV radiation sources used in the medical sector, principally for the purpose of enabling a comparison between the properties of artificial light and natural radiation. Thermal radiation. All material objects emit thermal radiation. The spectral distribution of an idealized blackbody should obey the Planck's radiation law. A blackbody is a hypothetical perfect emitter and a perfect absorber of thermal radiation. The Planck law predicts important properties of thermal radiation that were first deduced experimentally. The radiant power emitted by a blackbody is related to absolute temperature by the Stefan-Boltzmann law. As you can see in the formula, B is the Stefan-Boltzmann constant and T is in Kelvin. The blackbody spectrum shifts towards the blue with increasing temperature. The maximum emission wavelength obeys Wien's displacement law. The emission spectrum of the Sun is close to that of a blackbody at 6000 Kelvin, with the maximum emission at 550 nanometer green light. The graph is spectral irradiance of blackbody radiation. The total emitted radiation increases with the fourth power of the absolute temperature. According to Wien's law, the product of the absolute temperature and wavelength of maximum emission is a constant. The spectral irradiance of thermal radiation emitted by a real object depends on the material and surface treatment. The ratio of the actual emitted power at a given wavelength to that of a blackbody is the emissivity. The typical emissivity of a tungsten filament is about 0.4, while that of a human skin is approximately 0.98 at 3 micrometer and 4 micrometer. The concept of color temperature is used in the photography and lighting industries. The color temperature may have little relationship to the physical temperature. Incandescent lamp. Incandescent lamp consists of a tungsten filament in a glass envelope filled with an inert gas and heated by an electric current to about 2500 Kelvin. The emitted light is the thermal radiation of the hot filament. The useful lifetime of an incandescent lamp is limited by the deposition of black metal on the envelope and oxidation of the filament. The color temperature of an incandescent lamp is higher than the physical temperature because the wavelength variation of tungsten emissivity shifts the spectrum to blue. Conventional incandescent lamps are thermal radiator with a coil-shaped tungsten wire. The coil, which incandesces through the passage of an electric current, is mounted in a sealed glass bulb with a vacuum or in an inert gas atmosphere. Tungsten is used as coil material because out of all metals it has the highest melting point. Halogen incandescent lamps. At high temperatures, tungsten vaporizes and deposits on the internal bulb wall. This resulting blackening of the bulb can be reduced by a high pressure of a filling gas. But limits are set for any possible increase by reason of the restricted mechanical strength of the pear-shaped bulb of standard incandescent lamps. Table is important technical properties of halogen incandescent lamps. In order to minimize this bulb blackening, it is possible to add a small quantity of halogen to the filling gas. At lower temperatures occurring in the vicinity of the bulb wall, the halogens form together with tungsten gaseous halides, which are then decomposed again high temperature in the vicinity of the coil. In this process, the tungsten is deposited on the coils and the halogens are available again for repetition of this process. Two further advantages are achieved by this technique. The bulbs can be made to be substantially smaller, and in that small, heavy bulb, the pressure of the filling case may be drastically increased. This in turn leads to a marked reduction in the evaporation of tungsten. Accordingly, for the same coil temperature, halogen incandescent lamps last longer than standard incandescent lamps. Discharge lamps generate radiation when current flows through gases or metal vapors. To convert the initial non-conductive gas to a conductive state, every discharge lamp needs to be ignited. This takes place by means of high voltage, which are briefly applied and which are generated by specially designed starter or ignition system. The higher the vapor pressure in arc tube, the longer is the warm-up time. This warm-up time can take up to 15 minutes. Exact information can be found in technical specification. High-pressure mercury lamps. These are compact lamps, in most cases having an ellipsoidal bulb containing a so-called burner filled with mercury. Just like all discharge lamps, these types also has to be operated with current-limited adapter systems because of the negative current voltage curve. After ignition, which takes place automatically by means of a built-in ignition probe, a few minutes are required before the mercury has fully vaporized and the vapor pressure of some bar has been built up. This high mercury pressure has two effects. The discharge is constricted in the middle of the discharge vessel so that a high radiation concentration occurs there. Table is properties of high pressure mercury lamps. Metal halide lamps. These are like with high-pressure mercury lamps, but with metal halides added. These radiators emit not only the mercury spectrum but also the typical spectrum of the metal introduced in most cases consists of many lines. Non-short arc lamps. These radiation sources provide high radiation with a daylight light spectrum in the visible range. In industrial application, they are mainly used for film projection and for solar simulation. In the scientific sector, they are used in photochemistry. Just like the spectrum of the sun, the lamp emission proceeds almost equally energetically within the entire visible range. Fluorescent lamps. A fluorescent lamp is a low-pressure mercury arc with a luminance coating or phosphor on the inner surface of the glass envelope. The relatively weak emission lines of the mercury arc are superimposed on the broad luminance band of the phosphor. Fluorescent lamps are mainly used in general lighting application. The UV radiation of these so-called white lamps start with the low intensity at about 300 nanometer. Special fluorescent lamps used in phototherapy of skin disease include the sun lamp, emitting 60% UVB, the earlier type of UV lamp emitting 20% UVA with less than 3% UVB, and the UVA and UVB lamp emitting about 30% UVE and 8% UVB. Besides the typical characteristics of commercial fluorescent lamps, where lambda max is the maximum emission wavelength of the phosphor and delta lambda is the full band at the half maximum intensity. Fluorescent lamps with smaller diameter exhibit higher radiation, higher yields of radiant intensity in reflectors, more radiant intensity and better luminary efficiency. Light emitting diode. The LED is a p-n junction diode which emits lights when an electric current passes through it the forward direction. In the LED, the recombination of charge carrier takes place. The electron from the n side and the hole from the p side are combined and gives the energy in the form of heat and light. The LED is made of semiconductor material. Construction of LED. The recombination of the charge carrier occurs in the p-type material and hence p material is the surface of the LED. For the maximum emission of light, the anode is deposited at the edge of the p-type material. The cathode is made of gold film and it's usually placed at the bottom of the N region. The simple transistor can be used for off-on of a LED as shown in the figure on the side. The base current IB conducts the transistor and the transistor conducts heavily. The resistance RC limits the current of the LED. Working of LED. The working of the LED depends on the quantum theory. The quantum theory states that when the energy of electron decreases from the higher level to lower level, it emits energy in the form of photons. The energy of the photons is equal to the gap between the higher and lower level. The LED is connected in the forward bias, which allows the current to flow in the forward direction. The flow of current is because of the movement of electron in the opposite direction. The recombination shows that the electrons move the conduction band to valence band and they emit electromagnetic energy in the form of photons. LEDs and phototherapy. Within the field of dermatology, advances in the use of light-emitting diodes have led to their clinical application for a variety of medical and cosmetic uses. One phototherapy device has demonstrated beneficial effects over a range of clinical applications. Using LEDs with frequencies of 415 nanometer, 633 nanometer and 830 nanometer, this device has demonstrated significant results for the treatment of medical conditions. The LEDs that using phototherapy is beneficial for a range of medical and aesthetic conditions a counter in the dermatology practice. Often blue and red light are used in combination to help fight acne. The blue light targeting the good bacterium acnes and the red light targeting inflammation and redness. This picture example of phototherapy system that use LEDs. Photomedical capsule that emits blue light for Helicobacter pylori treatment. The system consists of modules for pH sensing and measuring, light emitting diode driver circuit, radio communication and microcontroller, and power management. The first functional unit consists of a pH sensor and a measuring circuit to detect the pH value. The pH value is one of the most important physiological parameters of the digestive tract. The pH sensor has two electrodes. The positive electrode measures the change of voltage and the negative electrode serves as a reference input. The second functional unit is the optical source composed of blue LEDs and LED driver circuit. Multiple LEDs instead of single chips are designed with serial connection. Wireless communication and microcontroller module form the third functional unit that facilitates information exchange among the receiver, MCU, LED driver and pH sensor. The wireless communication module transmits pH value outside the body. The MCU can accordingly modulate the power management of LED driver to change the current of LEDs or other system parameters. The MCU consists of the microcontroller and its peripheral components. The last significant unit of the system is for power supply. These units contain a cell battery and a power management circuit. Lasers. A lamp is a device that converts chemical, thermal, or electrical energy to light. The microscopic mechanism usually involves a sequence of random events leading to unsynchronized emission of photons. For example, thermal radiation is emitted by vibrating atoms and arc lamps utilize electronic transition between energy states of the filling gas. The unique feature of a laser is the synchronization of the microscopic light emitting events. Laser light originates from the quantum transition between energy levels of an active medium, which may be a gas, liquid, or solid. The only limiting factors are the properties of the atomic and molecular energy levels of the active medium and the feasibility of achieving a practical design. Laser light is highly collimated, highly coherent, and approximately monochromatic. The required synchronization of light emission in a laser is achieved by the process of stimulated emission. Types of lasers followed very rapidly. Figure 47 summarizes the properties of some lasers used for biomedical applications. Fiber optic light. Fiber optic lights are also used in phototherapy units. These units deliver high energy levels, but because spectral power is related to the size of the light field, the smaller paths are less efficient than larger wrap-around blankets. The drawbacks of fiber optic phototherapy units may include noise from the fan in the light source and a decrease of delivered energy with agent and or breakage of the optic fiber. In the example, first we converted the electron volt to joule, then we found the frequency from the energy formula and calculate the wavelength.
Widely skin disorders and treatments. Skin disorders. Skin conditions like eczema, psoriasis, vitiligo, itchy skin, and the skin symptoms of cutaneous T-cell lymphoma can be treated using phototherapy. The phototherapy treatment involves using UV light, a kind of light present in sunlight, to reduce skin cell growth and inflammation. There are three main types of phototherapy used for skin disorders: broadband UVB, narrowband UVB, PUVA. The effects of phototherapy for skin disorders are usually temporary. This means it is not a permanent treatment, and you may have to undergo numerous sessions, also known as maintenance therapy, of it over your lifetime to maintain the results. Mechanism of action in vitiligo treatment. A common autoimmune disorder, vitiligo, causes the depigmentation of the skin due to the loss of melanocytes. In this condition, PUVA or narrowband UVB is used for the phototherapy treatment. In both cases, the UV light stimulates the amelanotic melanocytes in the skin. Then they get activated and proliferation occurs, leading to the production of the melanin. This melanin migrates outward the adjacent depigmented areas and causes perifollicular repigmentation. Vitiligo treatments. Mechanism of psoriasis and treatment. Psoriasis is a common papillosquamous disorder that is characterized by well-demarcated red scurry plaques. In this condition, the skin becomes inflamed and hyperproliferation of the skin occurs. In psoriasis-like conditions, the narrow band decreases, lymphocyte proliferation, natural killer cell activity, cytokine production, suppressing the immune activity of the body. Treatment of psoriasis. Mood and sleep disorders. Phototherapy is also used to treat mood and sleep disorders, although it's most commonly referred to as light therapy in this context. The major conditions it is used for are seasonal affective disorder, SAD, and circadian rhythm sleep disorders. Let me explain circadian rhythm sleep disorders. Phototherapy can help those who have circadian rhythm sleep disorder, such as delayed sleep phase syndrome, make the shift to normal sleeping patterns and times. Seasonal affective disorder. Seasonal affective disorder is also known as seasonal depression, and it is brought on by seasonal changes, usually beginning in fall and lasting throughout winter. Light therapy for SAD involves using a light box, a specially designed box that emits soft light at a standard wavelength. Light therapy used this way has a number of side effects you should be aware of. Some of them are headaches, fatigue, insomnia, hyperactivity, and irritability. Light therapy is usually recommended for SAD because while it does have side effects, they are minimal and usually temporary, and it is an easy, relatively cheap treatment option. Cancer and precancers. A certain kind of phototherapy, known as photodynamic therapy, is used to treat some kind of cancer and precancers. It involves using a special type of drug called a photosynthesizer in combination with special kind of light. Photosynthesizers produce a kind of active oxygen that, when exposed to specific light wavelengths, kills nerve cells. The photosynthesizer drug is applied topically to the body. Both normal and cancerous cells absorb the drug, but it is thought that the drug concentrates preferentially in quickly dividing cancer cells. Furthermore, normal cells clear the drug faster than cancerous cells. So, at the point when most of the photosynthesizers has left the healthy cells, but it's still present in the cancerous ones, light is applied to the area to be treated. A reaction occurs between the light and the photosynthesizer's drug, creating activated oxygen inside the cancer cells. This activated oxygen kills the cancer cells. For newborns, phototherapy has been used for over 6 decades to treat jaundice. Jaundice is yellowing of a baby's skin, eyes, and body tissues as a result of excess bilirubin. In this case, the phototherapy is used to reduce the baby's bilirubin levels. Bilirubin absorbs light, which results in the breakdown of bilirubin to substance that the baby's body can process and excrete. There are two major ways babies with jaundice are treated with phototherapy. The usual way is to cover babies' eyes and place them under halogen spotlights or fluorescent lamp lights. For babies who are born preterm or have already been treated with overhead conventional lights, blankets may be used, also known as fiber optic blankets. These blankets are laid with fiber optic cables which shines the blue light onto the baby's back and body. Compact fluorescent light tubes and blue light emitting diode devices are also used to give babies phototherapy treatment. They can be kept close to the babies' bodies as they do not produce a lot of heat. Treatment of jaundice. Most pediatricians understand phototherapy as the use of visible light for the treatment of jaundice. For treatment of jaundice, light in the range of approximately 400 to 500 nanometer. Jaundice is a commonly encountered problem after birth and occurs in 60 to 70% of term infants and nearly all of preterm infants, including those near-term infants, 35 to 38 weeks gestational age. The etiology of this transitional jaundice of the newborn is complex, but can be best understood simply as an imbalance between increased production and decreased elimination of bilirubin related to a temporarily impaired conjugation system of the liver. The major mechanism of bilirubin photoalteration. With an impaired hepatic conjugation system, the near-term infant has a relatively increased bilirubin production rate as compared with the term infant. Therefore, when superimposed on a propensity for a later and higher peak total bilirubin, near-term infants are even at a greater risk for developing jaundice than the term newborn. Moreover, any infant that has a pathologic increase in bilirubin production caused by increased RBC destruction or any other pathologic increase hem degradation or a genetically impaired conjugation system is also at a greater risk for developing jaundice. Photobiology of bilirubin. The rate of removal of unconjugated bilirubin from the body during phototherapy depends on the following three related processes. 1. The rate of bilirubin photoalteration. 2. The transport of photoproducts from the skin to the circulation. And 3. The excretion of these photoproducts by liver and kidney. Figures show that wavelength using for bilirubin therapy. Efficacy. The therapeutic efficacy of phototherapy is dependent primarily on the following factors: the spectral qualities of the delivered light, wavelength, range and peak, intensity of lights, so irradiance, exposed body surface area, BSA, skin thickness and pigmentation, the total bilirubin at clinical presentation and duration of exposure. Irradiance. In the current American Academy of Pediatrics guideline, intensive phototherapy is defined as the use of blue light in the 430 and 490 nanometer band delivered at the 30 microwatt per centimeter square per nanometer or higher to the greatest PSA as possible. In clinical practice, irradiance is traditionally measured with a handheld spectroradiometer, which is designed to be sensitive only to blue light at a wavelength range centered at 460 plus or minus 10 nanometer. Thus, these radiometers, most of which appear to have a unique range and peak sensitivity, measure only the light assumed to be effective for the photoalteration of bilirubin. There are a number of light meters that are commercially available for quantitating spectral irradiance. Exposed surface area. Effective phototherapy is very much dependent on exposure to the largest PSA of the newborn. The greater the area exposed, the greater the rate of total bilirubin decline. At present, the limited PSA exposure by all light sources is the greatest impediment to effective phototherapy. In general, with the present overhead and underneath devices used singly, only up to 30% of PSA is exposed to light. The variability and limitation is attributable to the dimensions of a device's light footprint at the manufacturer's recommended distance. Irradiance. In the current American Academy of Pediatrics guideline, intensive phototherapy is defined as the use of blue light in the 430 and 490 nanometer band, delivered at the 30 microwatt per centimeter square per nanometer or higher to the greatest PSA as possible. In clinical practice, irradiance is traditionally measured with a handheld spectroradiometer, which is designed to be sensitive only to blue light at a wavelength range centered at 460 plus or minus 10 nanometer. Thus, these radiometers, most of which appear to have a unique range and peak sensitivity, measure only the light assumed to be effective for the photoalteration of bilirubin. There are a number of light meters that are commercially available for quantitating spectral irradiance. Exposed surface area. Effective phototherapy is very much dependent on exposure to the largest PSA of the newborn. The greater the area exposed, the greater the rate of total bilirubin decline. At present, the limited PSA exposure by all light sources is the greatest impediment to effective phototherapy. In general, with the present overhead and underneath devices used singly, only up to 30% of PSA is exposed to light. The variability and limitation is attributable to the dimensions of a device's light footprint at the manufacturer's recommended distance. Fiber optic systems. The main advantages of these systems are that while receiving phototherapy, the infant can be held or even nursed and the covering of the infant eyes is not necessary. Although a boon to the home phototherapy market, these systems often provide only homeopathic doses of light for treatment of jaundice because they have a low average spectral power and treat only a small portion of PSA. These devices can be used as an adjunct to conventional overhead application of phototherapy, providing double phototherapy, thereby more closely approximating circumferential phototherapy, which has greater efficacy because of greater PSA exposed to the light. Risks of phototherapy. Phototherapy contains a small proportion of risks compared to its benefits, such as photoaging. As a result of phototherapy treatments using ultraviolet rays, these rays may progress gradually at the molecular level and damage the skin. Skin cancer. The risk of skin cancer is also caused by ultraviolet rays. Exposure to high amounts of ultraviolet light causes skin cancer. This risk is directly proportional to the duration of phototherapy and direct contact of light to the skin. Immunosuppression. The light exposed during the treatment is suppressing the immune system. Skin cancer and photoaging that we mentioned earlier is actually due to immunosuppression. Eye diseases, especially as a result of photodynamic therapy applied for cancer treatments and PUVA therapy, the eyes become more sensitive to light, and if the eyes are not protected during the treatment, cataracts may occur due to sunlight or bright light. People in the high-risk group, pregnant or breastfeeding women, people with skin cancer in their family, liver patients, discoid lupus patient. Let me explain discoid lupus. A type of skin diseases, generally on the face, that usually occurs as a result of genetic or antipsychotic trauma.
Okay guys, we hope that you understand some basic concepts of the phototherapy and how it's affect the treatments, some skin disease or something like that. And we have some question for our concept, and let's start with the true-false question. The first one is the irradiance level within a certain wavelength factor in the efficiency of the phototherapy. Is that true or false? Actually, it's true, because the irradiance or the light intensity refers to the number of photons as directed or to the received per square centimeter exposed photosurface area. And the second one is the phototherapy is rarely needed following an exchange transfusion for hyperbilirubinemia. Actually, this is false, because we really needed for the treatment we really needed the phototherapy for the treatment hyperbilirubinemia. The third one is the longer wavelengths penetrate deeper into tissue. Is that true or false? Actually, it's true. Remember from the ultraviolet radiation, the first chapter, the wavelength, and this is remember that the radiation behavior, and it's true. The last question is the ultraviolet B radiation has longer wavelengths than ultraviolet A radiation. The solution is the false, because ultraviolet A occurs in 400 to 320 nanometers, and the ultraviolet B is the 320 to 290 nanometers. And the second question, what are some benefits of the light therapy? And actually, it's really important question, and we can say it's the phototherapy or the light therapy increases the healing response, tissue repair, decreases the inflammation, pain, edema, or increase the nerve function, pain relief. Also, it's increase the immune function and increase the local blood flow via vasodilation. And the next question is the electromagnetic radiation waveband, also known as the ultraviolet B, is, and remember, it is the D, because the ultraviolet B radiation, we know that it's the range of 311 to 360 nanometer. And fourth question, what are the side effects of ultraviolet B treatment? The list for the phototherapy related side effects is much shorter than alternative psoriasis treatment options. The most common side effects are typically short-term and are similar to a sunburn, redness, discomfort, and dry and itchy skin. And the last question, how long does it take the phototherapy work? Actually, the phototherapy is the most commonly dosed in high outputs of the ultraviolet B light administered 2 or 3 times a week. Treatment lengths start at just seconds in length initially and expand to several minutes of exposure per treatment. An average 20 treatment sessions are necessary before patients begin to notice results. And this is our results. You can check the results also there. And thanks for watching.